The management of the hospital said the article was malicious, mischievous, devoid of facts, and designed to be injurious to the organization and individuals who work within it. According to the release, the selection of the Director of Medical and Professional Services, like other senior appointments inclusive of the Director of Medical Education and Nursing, were done through an open, transparent process which does not discriminate or favor any one particular person. The release also noted that Dr. Sheikh Amir served his entire tenure as DMPS and that it was at the conclusion of his contract, in accordance with best practice, the vacancy was advertised in the daily newspapers, including the Guyana Times, inviting qualified medical professionals, including Dr. Amir, to apply. 4 individuals, including Dr. Amir, applied and were all interviewed by an independent panel which consisted of personnel from the Board of Directors, the Ministry of Public Health, the University of Guyana School of Medicine, and the GPHC administration. At the completion of this process, the best candidate was selected. In the case of the position of Director of Facilities, Andy Mahadio was appointed to act for a limited duration and was subjected to continuous performance appraisal and evaluation. Mahadio opted to resign rather than continue in the employ of the GPHC, and his departure from the GPHC was without rancor. The GPHC is calling on the Guyana Times in future to verify the facts prior to publishing inflammatory articles. GPHC also noted speculative information being circulated on social media regarding the treatment and adverse reaction of several children who are suffering from cancer in the pediatric ward after the administration of medication. The management of the hospital is aware of this situation and has launched an investigation to determine the reason for the adverse reaction to the medication. That investigation involves the interviewing of all medical persons directly involved, along with an assessment of the medication administered. Further, the usage of that medication has been discontinued. GPHC is reassuring the public that every life is precious to its staff and every death is distressing. It is committed to continuing to work closely with all stakeholders, including the Ministry of Public Health, the Pan American Health Organization, World Health Organization, and other agencies in an effort to improve their services. For InfoHub, Anarakan.